Hello, and welcome back to the Black Dental Reserve podcast. I'm your host, Dr. Bridget White, and today we're joined by Dr. Morgan Celistan, an endodontist practicing in the Boston area. She obtained her Bachelor of Arts degree from Princeton University, my alma mater, where she majored in psychology. After Princeton, Dr. Celistan went on to earn her Doctor of Dental Medicine degree from Case Western Reserve University School of Dental Medicine, where she was awarded by the Ohio Division of the American College of Dentists, in addition to receiving the Robert Dean Fetter Award and the International College of Dentists Student Leadership Award. Wow. Dr. Celistan pursued further education at Harvard University, where she received her certificate in endodontics and Master of Medical Sciences in Oral Biology. During her time at Harvard, Dr. Celistan was honored to serve as chief resident in the final year of the distinguished 3-year program. I'm so excited you're here. Welcome to the show.
So much for having me. I'm so excited to be here.
Yes, this is so fun. I created the Black Dental Reserve to recruit more Black dentists to the profession, and the most important way is to share our narratives for inspiration. So just, tell us a little bit about your background. Where did you grow up?
Yeah, I grew up kind of all over the US. We moved around a lot when I was little because of my dad's job. So I was born in California. We moved to Jersey. We lived in Texas a couple times, Virginia a couple times. But I did middle school and high school in Illinois. So I usually say I'm from Chicago, even though I'm from kind of all over. And then, like you mentioned, I did undergrad in New Jersey again. Then I went to Cleveland for dental school. And then finally, I've ended up here in the Boston area.
Okay, cool. And do you like Boston?
I do. I feel like kind of controversial. A lot of people don't like Boston, but it's treated me really well so far. So I've enjoyed living here.
Well, that's great. Yeah, I mean, if you spend time in the Midwest, then I guess the Boston winters, you're used to that windshield factor.
Already got so we're fine.
That's great. Well, so tell us about, like, were you always interested in dentistry, healthcare, science? Where did you get your inspiration?
Yeah, so when I was about 6 or 7, I decided out of nowhere that I wanted to be a dentist. Nobody in my family is in healthcare at all. Um, But I popped up one day and I was like, hey, mom and dad, I want to be a dentist. And they were like, cool. Bought me like a little children's typodont. And away we went for the rest of my career. So
Oh.
yeah, I really, once I got into school and everything, I was really interested in the sciences, very interested in art, working with my hands, and working with people. So it really turned out well for me.
Yeah, that's great. And so when you were applying to college, were you looking at, pre-dental programs? Like what moved you to want to go to Princeton?
So I wasn't doing any type of pre-dental or pre-professional education. After going through high school, I took an AP psychology class, and I thought, whatever profession I end up in, psychology is going to help me a ton. So I wanted to have my major be psychology no matter where I went. Knowing
Okay.
pursuing a liberal arts degree, I thought would be really useful. Again, no matter what profession I ended up choosing, hoping that it would still be dentistry. But then I went and got into Princeton. I couldn't say no. So I went there and I did all my prerequisites for my pre-dental education while doing a psychology.
Okay, yeah. So I tell people, I went to Princeton. I was class of 2000, aught, and and Princeton is a special place, Tiger Town. We used to call it. Do they still call it Tiger Town?
They don't still call it Tiger Town. Yeah, it's been there, but clearly I still rep a little.
I see the tiger there. Always a tiger landing on your feet. Yes. But one thing is that Princeton, they don't have like a pre-med major, pre-health major. So it sounds like, you did your core with psychology, and I agree. So many aspects of psychology, human psychology, that can be applied to any profession, especially healthcare. Well, how did you find, how did you spend your time at Princeton? Did you like it? Where did you live? Which college did you live in?
I was in Butler. I loved Butler. Getting to be in the air conditioning for all of you Princeton people. being in the air conditioning was much better than being up campus. But I spent all of my time studying, Mom. Um, but most of the time out studying class, I was with the step team. I was on the Princeton High Steppers. Um,
Wow.
no, I'd never done step before. I'd done a little bit of dance when I was younger, but I decided to get out of my comfort zone and join the step team. And that is where I made my absolute best friends that are still my best friends today. So I think Princeton was really great for me, not only for the education, but for the new experiences I had, the network that I made, and, being able to connect with other alumni like you and share those experiences together.
Oh, that's awesome. That step team must be new, or at least, since I left, we had Black Arts.
Yeah.
They did a lot of different activities, but I don't remember there being an official step team. But Princeton's the kind of place where if you want something to happen, you can create the club. And believe it or not, there's such a variety of students at Princeton with different interests. So something like step, and like you said, combining your dance background, and it's great, great cardio, if anything. But that's cool. Well, I'm so glad you like Princeton. I mean, look, I Princeton is near and dear to my heart. I always wanted to go to Princeton. I think that I kind of stopped at going to Princeton. I didn't even think about becoming a dentist till after college because I just thought
You'd
I'm
reach.
gonna go to Princeton. But that's wonderful. And then so you're at Princeton, you majored in psych, and then did you have any pre-dental shadowing opportunities? I'd like to talk about. I did have a classmate at Penn in dental school who was a few years behind me at Princeton, and she said she always knew she wanted to be a dentist, and the guidance counselors had no, they didn't even know how to apply to dental school. How was your experience with applying to dental school?
It was a little bit difficult, especially because I had a very strong idea about how I wanted my education in college to go. I wanted to study abroad. I wanted to take classes that I enjoyed. I wanted to take art classes. I didn't only want to take science classes and get an A plus in every class. I wanted to enjoy my time and make sure that I had a very fulfilling experience. So in applying to dental school, I did also want to apply straight out. I didn't want to take an additional year to do a post-bac, even though that's a great option if that was something I needed to do. But I was hoping that I could go straight through. Most of my colleagues wanted to do medicine, so a lot of the focus on the pre-health mentoring was for medical school. And while there are a lot of similarities, there are very specific differences when it comes to dentistry. So I don't know that I had all of the guidance that I might have wanted at that time, but
Mhm.
work. I ended up studying abroad. I had to take orgo during a summer course at a local college. Not
Oh,
recommended to me, um, but I gave it my all, and I ended up applying, and I got in, and it worked out.
great. Of course you did. And where did you study abroad?
I studied abroad in Australia.
Oh my gosh, that is so cool.
Yeah.
That's awesome. Well, it sounds like you really took advantage of all the opportunities at Princeton, the way you needed to get it done. And it's actually not unusual. I had friends who were pre-med and then they took a chem class or two in the summer. Yeah, there are programs all over. One even went up to Harvard to take chemistry. And I was like, aren't you tired? Like, take
Right.
the summer off. But but that's why it's important for people to know there's not just one path into dentistry. There's not just one path of what you study in college. And I think I didn't realize how technical dentistry was, but I always look around and I feel like I'm the only person that wasn't a science major. And uh, you're right. But it's funny. I went for my oral surgery consult to get my wisdom teeth out,
Mhm.
and I was considering dental school. And I asked my surgeon, "Do you think I'd be a good dentist?" And he said, "Yeah," because I said, "But I didn't study science, and I worked in entertainment." He's like, "Oh yeah, because you're gonna have to talk to people all day long. So you gotta talk. They don't want to talk about their teeth. They don't want to talk about science." So it was funny. So it really is true because dentistry is so interpersonal that you can bring, your background and then of course your perspective on relaxing patients, especially with endodontics. In terms of your mentors, where did you have opportunities to shadow dentists? Were there people in your your community at home that works in the field? Who were your mentors?
So obviously my main mentor was my mom. She, to this day, if I have a question, if I have a problem, I call my mom. She knows nothing about dentistry, but she still
Oh
helps.
my God.
Um, was, going through the process and starting to apply and things, I did reach out to some local dentists in my area. One of my really good friends from high school, her dad was a dentist. He wasn't my dentist, but I knew him. So
Hmm.
it allowed me to shadow him a good amount, which was really, really helpful. Um, but I didn't have a lot of dentists that I specifically knew, and I didn't have any Black dentists or especially Black female dentists who I could kind of ask these questions about as I was going through the process. So that, as I moved forward and got into dental school, I was able to make more of those connections. But at the beginning, it was definitely difficult.
I see. Yeah, they're definitely there. I'm surprised you are the second. Well, now with as Black Donor Reserve's growing, I'm actually reading and meeting more Black female endodontics, and that is amazing. I've been practicing for 18 years, and I have even in DC, I've met some Latinx female endodontists, but not Black women until just very recently. So we're so glad that you have pursued endo. And let's get into that. Like, how was dental school? Um, did you feel prepared for dental school? And then how did you choose endo as the specialty?
I don't know if I can fully prepare you for dental school.
No.
It's all the didactic information. It's all the hands-on skills that you never knew that you would need to, like, you imagine going to class the first day and they say, make a tooth out of wax. What?
Right.
That's what we did. Uh, there were a lot of curveballs, but it was all worth it in the end. I ended up choosing endo kind of late. I chose in my third year. I was planning to be a general dentist, and
Hmm.
got into clinic, and I immediately realized that general dentistry was not for me. I wanted to really excel at one thing and
Hmm.
learn everything about it and be able to be great at that one thing. And for me, general dentistry there were too many things for me to want to be great at. So I kind of went through the list. I was like, oral surgery, that's too many years. Perio, that's too much blood.
I always say that about perio. That's so funny.
So I kind of, went through all the different specialties and figured out what really worked with my personality and how I like to work. And I landed on endo with the help of some wonderful mentors that I got at Case Western. Andre Mickle, who is the head of the postdoc program there, who is a Black
Okay.
man. He was instrumental in helping me kind of realize my endo goals. As well as Dr. Mina Sherry, who was the pre-doc director there, and also the dean of the dental school at Case Western is a Black endodontist. So
Wow.
yeah, I
Oh
had
my
all
goodness.
the models there
Yeah.
to kind of show the way. So at that point during third year, I kind of had to realize it quickly. Once I understood that's what I wanted to do, I had to apply that summer because I wanted to go straight out of dental school, of course, into residency,
Hmm.
taking a couple years off. Um, so I went ahead and got all my application things together, and then summer after third year, I put in my applications.
I had no idea that Case Western had a Black dean, and it sounds like their faculty are pretty, a little more stronger representative of the Black population. Some schools have, they don't, there are 5 or 6 dental schools that don't even have Black dental students. So there's a
Ooh,
lot of work to do, yeah, with bringing racial and ethnic diversity into the field, starting with the academy. So I want to hear about Harvard, especially don't say Harvard to somebody that went to Princeton, but no,
oh,
seriously, I you were chief resident. That's awesome. Was that a lot of work? Like, what was that like? Tell us about. Assume you're speaking to someone that has no idea what endo is.
mhm.
If you can define endodontics, and then just kind of give us a brief overview of your residency program.
So for the absolute basics, endodontics is basically working on the nerve of the tooth. So we do root canals and we do microsurgeries. Um, the residency process, depending on the school you go to, it's either a 2 or a 3-year program. Some of them offer master's degrees as well as the certificate in endodontics. So I chose a 3-year program that gave me both a master's in oral biology and a certificate in endodontics. So during the program, we do a lot of what's called evidence-based dentistry. So it's studying both current and classic literature to understand the reasons why we do what we do. What are the biological reasons for every single thing that we perform in every procedure? Why do we need to isolate the tooth? Why do we need to use sterile instruments? What irrigants do we need to use? And why is it important which irrigants over another? So all those different things we have to learn in the classes. And then in addition, you take all the master's classes. So those are all of the kind of, when you think about dental school, like histology, we take those classes over again with all of the different specialties within the school, because we're all getting the master's degree in oral biology. Then as chief resident, I was doing a lot of background work. So in addition to doing all of the didactic work that we do, we also work in the clinic. So making the schedule for all the different residents. There are 12 residents in my program at any given time. So I created the schedule for everybody, all the different lunch and learns that we had, having guest visitors come in, scheduling all those types of things. Any problem that anybody had usually came through me to help, make sure that everything's running smoothly. So it definitely gave me a great opportunity to have some leadership skills develop, as well as, being able to understand what it is like in an academic setting. As somebody who wants to be in academia, it's really important to understand the inner workings of communication between different departments, between different like hierarchical levels within the school, and being able to work with all those different areas in a really positive way to make sure that everybody at the end of the day is happy. And especially at the end of the day, the patients that are coming in to see you and all of your co-residents are leaving the building happy as well.
This is the meat and potatoes, especially endo. As a general dentist, we just look at endodontists like, oh, you do 2 procedures, you just golf all day. But there's definitely it's one of the most detail oriented aspects of dentistry. So it's amazing, and it sounds like you said, for in terms of that core, all the specialties, having that foundational analysis of all the different types of science, and as it applies to patient care, like, yeah, why do we use sterile instruments? Why are these irrigants helpful? And then I would imagine, especially as research develops, I mean, now we joke about the MB2, and I say when I was in school, they told us it was 30-40% prevalence, right? I was in school a while ago, but certainly with our technology, our X-ray, radiology developments, and our microscopes. I mean, you guys. So, do you enjoy using the microscope?
Love the microscope.
Oh, you do. You can't live without it. Okay.
Yeah. Sometimes now, like if I have to just do a consult or something, I'm just looking at their mouth. I'm like, there's so many teeth. There's a tongue. What's going on?
Laser focused. Yeah.
Magnification is so high. You can see like 3 or so teeth. So it's very, very focused in, because you're looking not just at the tooth, you're looking all the way inside the tooth into the canals. So looking at a whole mouth with everything going on that's crazy at this point.
There's an endodontist in Austria, and he takes great photography of his, microscopic, lens, and it really does. The tooth is beautiful, all of its curvatures. But yeah, let's talk about your research. I mean, it's so timely that this discussion of your research. You won not only institutional awards at Harvard, but also national awards for your research of the social and implicit biases, that influence our pain management directives. So can you talk about your research and really the findings?
Yeah. So first, I want to give a little shout out to my program director, Dr. Gibbs, because when I came into this program, I had this kind of wild idea about research that is something that hasn't been looked at in the endodontic literature and not very much in the general dentistry literature at all. And she was like, find a mentor who knows something about it and go for it. So I was really, really blessed to have somebody who had my back and, wanted me to pursue something that I think is really important. So what I was looking at is how patients with post-endodontic pain, so after you have a root canal, if you're having pain, there are a number of different things that we can do to help a patient. So, prescribe medication, we can call and check up on them, we can give them an emergency appointment, lots of different things. But knowing that there are a lot of implicit biases, especially based on race, how would this, if at all, influence how we're treating these patients in pain? So there's a lot of research showing in the medical literature that patients who are Black tend to get less pain management, or are perceived to be in less amounts of pain. Also, women are perceived to be in less pain, or aren't given as much analgesic care. So I had to kind of pare this big idea down very small to fit into a thesis project that I could complete in 3 years. So I ended up creating a project and making different vignettes of different patients who are white and Black. And then I gave this survey to endodontic residents across the US and basically showed them scenarios and said, hey, this is your patient. They've come in and this is what's going on. What would you do? How likely are you to prescribe them a narcotic, to prescribe a steroid, to prescribe an NSAID, to call them up every day until the problem resolves? And so they went through this whole thing, and then they also filled out an inventory called the COBRA scale, which is the Colorblind Racial Attitude Scale, which is a measure of implicit bias. And at the end of it, I ended up getting a 37% response rate, which is excellent. I was really, really excited about that. And we ended up finding out that from our participants, race didn't have a big impact on what they would prescribe for a patient. They basically went by what the rules are of the literature, which is awesome. Where we difference is participants who had higher levels of implicit racial bias were less likely to follow up by phone with a Black patient than a white patient. Whereas people with lower levels of implicit racial bias were more likely to follow up with a Black patient. So it kind of soft skills kind of areas. If there's a rule of this is what you're supposed to do, they do it for everybody. But if there isn't a rule, then how is this differing? So this really showed up in communication for us. And that's something that's also been shown in a lot of different literature, actually in psychology, on in-groups and out-groups in different ways that humans relay implicit biases.
Wow, excellent. Bravo. This is this is amazing. Like, congratulations, and I'm so glad that you were recognized for this research. And we should discuss this amongst ourselves as colleagues, share it with our friends in the greater medical community. And then socially, there's a lot of attention being paid to racial bias in medicine, and especially pain. How do you feel as an endodontist in terms of dealing with patients who are experiencing pain? How do you compartmentalize that? Because it can be overwhelming for all dentists to be so close to pain.
Yeah, it is difficult, but also that's every day. So I come into the room and I say, "Hi, what brings you in today?" And they're like, "My tooth hurts." And I'm like, "Oh, again, just like the last patient. That's crazy." So it's a little bit difficult in that manner, and especially trying to keep an upbeat mood. And because if I'm upset and I'm not feeling great, and the patient's like, "Oh, my tooth hurts," and I'm like, "Oh, that sucks." Nobody's really going to be happy. But
Right.
if they say my tooth hurts and I'm like, "Hey, I know how to help," then
Uh-huh.
really change the mood, and it can make things really positive for the patient. And they come in one way, and I have the capacity to help them leave in a better state, which makes me feel really good at the end of the day.
Oh yeah, taking patients out of pain, it's life changing. There's you can't understate that. It sounds like all these things have come together. I mean, when you were discussing your research findings as they were connected to psychology and how we communicate, and then just that actual aspect of the delivery of care through communication, letting patients know what you're doing, why you're using this scary microscope, you
Right.
know. Um, and then you're staying on at Harvard to teach. You're going to be faculty. That's exciting. Are you doing that in a part-time capacity?
Yeah, so I'm working on onboarding right now. As we know, that takes
Okay.
time. Um,
Yeah.
but I am planning to do part-time and then work in an office outside of Boston for the rest of the time while working on getting this research published, knock on wood.
Yeah. Oh my good. Oh girl, it's going to be published. That's wonderful. I really I can't stress, it's like a call to the ADA, it's a call to the profession, how much work needs to be done, efforts to recruit and retain historically underrepresented, racially diverse faculty. We need more Black instructors. We need more Black deans. We need more outreach coordinators. We need to explain how dental education can be paid for. We need more scholarship programs. I could go on and on and on. So, I forgot to say, when you were talking about Princeton, I was a Woody Woo major. So excuse me, I was a school of policy.
There it is.
So, as Princeton has upgraded and brought more current terminology to its infrastructure. It once was called the Woodrow Wilson School of Policy, Public Policy and International Affairs, and now it is called the Princeton School of Policy and International Affairs. Perfect. So, as a policy major, I was always learning about inequities and disparities. And really, they're all connected. Without health, without good oral health that affects your systemic health and vice versa, and without health, we cannot thrive economically. We cannot pursue professional goals, and it affects our educational path, and it's all connected. And we are aware of a lot of the history has accurately been documented, and the disparities are well documented. And I say to any your experience, I think, especially in dental school with that diverse faculty, that seems to have been very impressionable because you saw faculty um, uh, thriving, right? You saw people in specialties thriving, and that I think makes the biggest difference. It's representation across the board. Where do you see the future of dentistry going? I mean, you're kind of in a field that is enhanced by technology, and as well as, like you said, good old soft skills. So what do you see for the future of dentistry?
Ooh, it's bright, that's for sure.
It's got a lot of color in it, right?
I very colorful. Um, I don't know where dentistry is going, but I know the role that I want to have in it. And I definitely want to be a part of other people's journey. I want to be a mentor to people. I want to be a teacher to students because I feel like there are hardships that I went through that I want to make sure nobody else has to go through. I want, you know, students of color, students of underrepresented backgrounds, LGBTQ students to feel that they can be in dental school and have a safe environment, that they can do research that's important to them and that people will care about and listen to and not feel like it's unimportant research or it's just, social research that's not as cared about as benchtop research. All of this is extremely important. And I want to be a champion for that in this field.
Wow. Well, thank you so much. You're perfectly suited and positioned, as my mother would say. My mom's like one of those people, like, you're in the best position possible. But it meant so much to me. I remember when you reached out to me, and the fact that we were connected through the Tiger Net, through our alumni avenues, is so important. And it's especially warm for me to hear that you're going to be grooming the future. The future providers, making them more culturally competent, making them more confident. I think a lot of times, like you said, if you don't feel that research that's part of your community is beneficial or, sought after, then you may not even raise the questions. You may just, skate on by it and not worry about it. But it only makes us better. It only makes us a better healthcare system. It helps our GDP. We spend so much money because we didn't do research on various populations, and so it's so important that we do both. We want to thrive economically with our practices. We want to help our communities, but we have to keep our arms and legs and ears in the academy for that research. So I'm so happy, and congratulations. What do you do for fun? Give me some fun time with Dr. Celistan.
Doc, yeah, honestly, what I do most is take care of my plants. You can see my newest one over here. Plants. I'm trying to pick up reading again now that residency is over, reading for fun and not just for, review courses.
Yeah.
Yeah.
Wow, well, good for you. Well, yeah, just relax. It's so true. It's funny when people say, "What are you reading?" You're like, "I have been reading for the last 30 years." Okay.
Nice fiction novel, like some chick lit on.
Exactly, exactly. Well, hopefully you get a chance to relax this summer. And the onboarding, I'm sure, is just a lot of tedious things for good measure, though. I remember when I did onboarding at Penn, it was like never ending. But I was refreshed to see that they've created policy to make sure that it's a safe environment.
Worth it.
Yeah. All right. Well, thank you so much for joining us on the Black Dental Reserve podcast, and we'll see you soon. Bye.
Bye.